Let's see about Abruptio placentae. What is Abruptio placentae? This is nothing but premature separation of a normally situated placenta leading to antepartum hemorrhage. This is Abruptio placentae. We have seen about placenta previa in our previous video, which is low lying placenta, but here the placenta is situated normally, but it is prematurely separated from the uterus. First, let us see the etiology for Abruptio placenta. It is more common with increasing maternal age and increase in parity, that is, it is more common in multiparous women, and smoking increases the risk by twofold. Next, preeclampsia, gestational hypertension and chronic hypertension. All these also increase the risk for Abruptio placentae. Next, uterine fibroids in pregnancy, polyhydramnios, others include multiple pregnancy, having more than one fetus, use of cocaine and other substance abuse, and recurrent abortions. All these are the risk factors for Abruptio placentae. Next, the types of Abruptio placentae. The types include concealed, revealed or mixed type. In concealed, the blood is retained inside the cavity and it is not visible outside. So, here there is a retroplacental clot, that is a clot seen behind the placenta between the uterine wall and the placenta, and the placenta is completely separated, but the membranes are still attached to the uterine wall. This is concealed Abruptio placenta. Next is revealed. In this condition, the blood escapes out through the vaginum and it presents as bleeding per vagina. Next, mixed type, which is the most common type, where there can be blood-stained liquor. And also there can be concealed bleeding. These are the three types of Abruptio placentae: concealed, revealed and mixed types. Next, let us see the clinical features. The clinical features depend on the degree of separation and the type, whether it is concealed, revealed or mixed type. So, first the symptoms. The symptoms include abdominal pain, bleeding per vaginum. These are the presenting complaints. There will be bleeding per vaginum associated with abdominal pain, and the uterus is tense and tender. Whereas in case of placenta previa, the uterus was relaxed and it was not tender. And there could be fetal distress or even death of the fetus can occur. So these are the symptoms. Coming to the signs of abruptio placentae: vaginal bleeding. This vaginal bleeding appears dark red in color, whereas in placenta previa it was bright red, fresh blood. Next, there can also be shock, which presents as tachycardia, hypotension, cold clammy skin, etc. Next, the fundal height is usually more than the period of amenorrhea. And there is uterine tenderness. Also, the fetal parts are not easily palpable. The fetal heart rate can be normal or abnormal or even absent. There will be uterine contractions. That is why the uterus appears to be firm, that is tense. Next, there can be features of pregnancy induced hypertension also. These are the signs of abruptio placentae. Next, coming to the investigations. The investigations include complete blood count, hemoglobin, hematocrit, that is PCV, urine analysis is performed to rule out pregnancy induced hypertension. Next, coagulation profile. Which includes bleeding time, clotting time, prothrombin time and activated partial thromboplastin time. Blood grouping and RH typing should be done. Renal function tests. Then ultrasound. This ultrasound, we can see the presence of retroplacental clot, which confirms the diagnosis of abruptio placenta. Also, if there is absence of clot, it does not mean that abruption is ruled out. So these are the investigations. Next, let us see about the grades of placenta, abruptio placenta. First is grade 0, that is when it is diagnosed after delivery, after seeing a retroplacental clot. Next is mild or grade 1. Here there is pain preceding the external vaginal bleeding. External vaginal bleeding. The patient does not have any shock and the fetal heart is usually unaffected, that is, it is normal. Next is moderate or grade 2 abruptio placenta, in which the bleeding PV is mild, uterus is tender, maternal shock is absent, whereas there is fetal distress present. The fetus is affected but the mother is normal. Next is severe or grade 3. Here the bleeding PV is moderate to severe, uterus is tender, both maternal shock and fetal distress are present, and this is also associated with complications like renal failure or coagulopathy. These are the 4 grades of abruptio placenta: grade 0, 1 or mild, 2 or moderate, 3 or severe. Next, the diagnosis is made by usually clinically an ultrasound has a sensitivity of 70%, and the differential diagnosis for abruptio placentae is placenta previa, about which we have seen in our previous video. The other differential diagnoses include acute hydramnios, in which there is sudden distension of the abdomen and there is increased pulse rate. For diagnosing acute hydramnios also, ultrasound is helpful. Next is rupture uterus. This is common in patients with previous caesarean scar. So, here the patient presents with abdominal pain and bleeding. In case of complete rupture, fetal parts may not be easily palpable. Next, other acute abdomen conditions like torsion of ovarian cyst, or acute appendicitis, or degeneration of fibroid. These are all the differential diagnoses. Next, the management of abruptio placenta. As in placenta previa, there is general management and obstetric management. In general management, 2 large bore IV lines and then the patient should be given crystalloids like NS or RL infusion, and then the blood should be taken for blood grouping and RH typing. So, next, ultrasound should be taken, urine output should be monitored. All these are general management which are almost same as that of placenta previa. Next, obstetric management. In case of severe cases of abruption, we should conduct immediate delivery of the fetus. What are the indications for C-section in abruptio placenta? There are 4 major indications, which are when there is live or mature fetus, and if the vaginal delivery is not possible because of any reason, emergency C-section can be done at any point of time to save the fetus. Next, in severe types of abruptio placenta, when the patient does not show an improvement in spite of resuscitative measures. And the last indication is when the urine output is constantly decreasing. These are the indications for C-section in abruptio placenta. Normal vaginal delivery is preferred if the fetus is dead and there are coagulation defects. So, in those cases normal vaginal delivery is preferred. So, now what are the complications and the causes of maternal mortality? The complications include hypovolemic shock, postpartum hemorrhage, renal failure, and coagulopathy. So, these are all the important points about abruptio placenta. We will see about the differences between the placenta previa and the abruptio placenta in our next video. Thank you.